The Health Minister, Edward Argar, who joins us now. Good morning to you, Minister.
Morning, Julia.
Good morning. Well, we are being told by the Prime Minister today, exclusive interview with The Sun, his plan to save Christmas, that we've got to obey this rule of 6, or we do face the festive fun being ruined, even a pub curfew at 10 p.m. How could you justify further restrictions on our personal freedoms, given the current rates of coronavirus in this country?
Well, there's no desire to do that. There's no wish to do that. No one wants to see any more restrictions, either national restrictions or even any more unnecessary local restrictions. And we want to see the restrictions that are in place lifted as swiftly as we possibly can. That comes down to people following the rules, following the regulations, doing the right thing, thinking hands, face, space, i.e. the basic hygiene stuff. If we do that, as the Prime Minister said, we will get this disease back under control, the infection rates down, and we will then be in a position to start looking at relaxing the restrictions. But we've got to all play our part in making sure we get that rate down, because this is still a very, very dangerous and unpleasant disease.
OK, well, we say we'll all play our part. Most people, the vast majority of people, are playing their part, aren't they? Why do you think their numbers are rising? Because some people aren't following the rules. Why then would we be facing, say, a curfew on being able to go to the pub or restaurant? Could kill off many pubs that have just reopened, just surviving, many restaurants and bars as well. And yet you're going to punish them, punish people who have been responsible, because some people, a few, aren't obeying the rules. That seems rather unreasonable to a lot of us.
You're absolutely right, Julia. The vast majority of the British people, as always, have done the right thing. It's entailed huge sacrifice. I know that. We've all seen it in our own lives, friends, family and others. But they've done the right thing because they know that that will help tackle this disease. And that's the whole aim of this, is that if enough people do that, and they are doing that, we won't have to implement measures such as that. We've seen it in Bolton, where there's a particular local spike, and it's one of the package of measures that can sometimes be used in local lockdowns. But there's no desire to see this done nationally. We want to do everything we can to avoid that. And you're right, no one wants everyone to have to suffer because some people break the rules, and particularly I'd include that no one wants to see our fantastic hospitality, pub and restaurant trade, either nationally or anywhere locally, have to suffer. And therefore, that's why it's important everyone sticks to the rules, which minimise the risk of something like that ever having to happen.
I think a lot of us who, I'm not an epidemiologist, I don't have any medical background, but a lot of us are a little bit confused. Maybe you as Health Minister can explain to us that I didn't realise that viruses could both tell the time and count so well. Can you explain to me why 6 people sitting at a table together in a pub at 9:59 p.m. is perfectly safe? And 7 people sitting in a pub at a table at 10:01 p.m. means we're all going to die.
Well, I wouldn't necessarily characterise it as you did there, Julia, but I take your point. The issue being that what we've seen in, for example, Bolton and some other areas is that it's that nighttime economy. It's towards the end of the evening when people have had a bit to drink, that sometimes people aren't always as aware of the rules or forget the rules. And therefore, you can see groups starting to get together, starting to break the rule of 6, starting to have that close contact. And it's one of the things that appears, and I say appears, to be a factor in driving up infection rates in those areas where you see large groups of people late at night who've enjoyed themselves perfectly reasonably with a drink or two, but who then sometimes don't follow the regulations.
Pubs, bars and restaurants are required to follow the licensing rules, and that involves them obeying all the laws. When I was a barmaid some 30 years ago, it's very, very clear. If I served someone who I knew or thought to be under 18, or if I served after the 11 o'clock closing time at the time, I would put my landlord's licence at risk. Why are we not making this a responsibility of landlords and the people running these pubs? Simply like, if people don't obey the rules in your establishment, you're going to lose your licence and you're going to be out of a job. That's a very simple way of policing it, without meaning you put these rules onto everyone else who is obeying the rules. Why don't we target it that way?
Well, there are 2 points there, Juliet. Firstly, you're right. A lot of pubs, take my own constituency, my local and other pubs, have gone to extraordinary lengths to make sure that they are sticking to the rules, that they're helping to make sure the rules are adhered to. When we had the local lockdown in Leicester City and parts of my constituency, pubs just outside of it were incredibly good at checking and asking people to book in and where their address was, and if they come from within or seek to come from within inside the lockdown zone, say, I'm terribly sorry. that really doesn't work and that's not within the rules. So there is a lot of that going on. But what we have to do here, and we've seen it in Bolton, as I say, we hope we don't have to see it elsewhere. The Secretary of State will announce later today what specific measures he's putting in place for the North East, and I'm not going to preempt that. We've only seen it had to be used so far in Bolton in a specific circumstance where the infection rate was so high, we had to take measures to control it. As I've said, I don't anticipate, and I would hope we will never have to see anything on a national level like that, or even more broadly with multiple local lockdowns. But it is one of the measures that does appear to be working in driving down those rates. So we've got to keep it as an option.
We know that the entire government policy is contingent on the test and trace system working. Lots of criticism of that yesterday in the House of Commons. Your boss, Matthew Hancock, the Health Secretary, he said a little while ago, if in any doubt you got coronavirus or your child has, get a test. Now, after speaking in the Commons yesterday, he's blaming people for getting tested when they don't need to. Which is it?
Well, there's two things again. I don't think he's blaming people. I think what he's saying, Julia, is he's setting out the factual background, not blaming people, but saying, we've seen June to August around a 63% increase in demand for tests. What we need to do, and what the Prime Minister has done very sensibly, I think very openly, is he's level with the British people, saying we've massively ramped up our testing per 1,000 people, tests daily. We're about 2.3, I think. That's double Spain, France, Germany's rates. So we've massively expanded the rates of testing. But he was very honest, and quite rightly so, with the British people, saying, but there's a lot more we need to do on the supply side. So yes, Matt was right to highlight demand is a factor, and anecdotally, he cited the figure of around 25% of people applying who didn't have symptoms, who shouldn't be applying, which has put pressure on the system. But that's not blaming people. That's not an excuse. We still have a very clear obligation to build on those levels of tests daily. And Dido Harding, James Bethell, who lead on this, are working flat out in parallel to saying to people, only get tested, only apply for a test if you've got symptoms and meet the criteria. Alongside that, we are rapidly expanding the test capacity to make sure the supply as well as the demand.
Well, we're told that there's going to be rationing of the tests until we can ramp up to a higher level. The Prime Minister's promised 500,000 daily tests at the end of October. Even that probably may not be enough by the time we've got all the autumn sniffles to deal with. But hospitals having top priority, the patients, the healthcare workers who need to be at work, care homes, obviously they've been promised routine testing. That hasn't happened over the summer as it's been promised. So that's being ramped up now. But we always knew when schools went back, there would be an extra demand for testing. Now, whether or not schools are obeying the rules, parents haven't got much choice if their child's been sent home, whether they're the bubble, whether it's a class or whether it's a whole school year, often hundreds of children, one child gets sent home. We've seen some schools where the entire school year has been sent home. They're told, your child can't come back until we know they haven't got COVID. A parent can't get their child into school unless they've had a negative test. What do you want parents to do in that circumstances? Those children haven't necessarily been in contact with someone who's had COVID. They haven't got any symptoms, but they can't go to school. What should a parent do in those circumstances?
Well, there's very clear guidance, Julia, to schools. And first of all, in terms of the prioritisation you talked about, teachers, of course, are one of the key worker groups that we'll be looking at in the context of that prioritisation to make sure that they can get priority tests. You'll see more on that in the next day or two when the Secretary of State makes the formal announcement on it. But in terms of schools, the rules are clear. If someone has symptoms, they should go home. They should seek a test. If it's negative, they can, of course, return. If it's positive, they'll have to follow the self-isolation. But if pupils don't or others don't have symptoms, they should be in school. They shouldn't be self-isolating if they have no symptoms and if they haven't been in close contact with someone who has tested positive. And what we're doing with schools, because this is complex, is that the local public health teams are there to advise schools and do advise schools on the best response if one or two or three pupils in a particular year bubble or year group come down positive. They will then advise on who's been in close contact, how to manage that. So if people have not shown symptoms and have not been in close contact, they should be in school.
Sir Keir Starmer have missed Prime Minister's questions yesterday, given that he was isolating at home with a child who had not yet had a positive test and has since had a negative test for coronavirus. So he didn't go to work. Teachers are not going to work and pupils aren't turning up to school in exactly the same circumstances. You just said they're in the wrong. So should Keir Starmer have turned up to PMQs yesterday?
No, I didn't say they were in the wrong. I said that in the case of pupils and class groups, because of how they are managed, public health, the local public health team would advise them as to who, how many, etc., being deemed in close contact and who should self-isolate pending the results of that test or pending symptoms. In Keir's case, I don't want to talk too much about an individual case because although Keir is leader of the opposition, he's got a family. It's a private matter for him. He hadn't had the results, I understand it, in time to come in for Prime Minister's questions. Therefore, he waited at home till he got those results. He followed the guidance. As I said, I don't know the exact timeline. It'd be wrong for me to comment further on him or his
It's just
family.
you can understand why it is pretty complicated for people trying to work out what's going on. One of the big issues lots of people have right now is the prospect, as I say, the testing capacity is not up to. Look, I always say credit where it's due. Always be honest about this. We've got the capacity up massively. It turns out it's not enough for the strategy the government is looking at. But we are looking, and you know as well as I do that the government is having meetings talking about 10 p.m. curfews. There has been a lot of talk about the risk of a second lockdown, even though the Prime Minister said it would be disastrous. Do you think all of these measures are actually consistent sort of with the level of risk we are facing, given the very, very small number of deaths of healthy people under the age of 60? Were you aware, for instance, are you aware of the number of people who've actually died in this country since February to early September who are healthy and that have no underlying issues under the age of 60? Do you know what that figure is roughly?
No, the figure isn't broken down in that way.
Oh, it is. It is. It is it is absolutely under Public Health England document. Do you want me to tell you what the figure is, or do you want to make a rough guess at how many huge numbers of people have died who are otherwise healthy in this country?
Go for it, Julia. But the point I was making...
It's 307, Mr. Argar. 307 people between February and early September who did not have any underlying serious health complaints under the age of 60 died in English hospitals this year from COVID-19. And yet we are looking at massive restrictions to people's freedoms, mass chaos, massive hit to our economy, hit to children's education. Do you think that the government's response has been proportionate, and is what the government is planning or looking at now is proportionate to the actual risk to the general population from this virus?
Well, in the spirit of what you just said, and I always try to, as you say, be sort of open and honest with your listeners.
Absolutely accept that.
And they will judge it as they hear it. I do think it's been proportionate because that statistic you cited, without any serious underlying health conditions, it is more complex than that. But we also have an obligation to take this disease seriously, to seek to protect those who are vulnerable in our society. I think the latest death toll in this country is 41,684. That's every one of those deaths is a human tragedy.
It is.
And every one of those deaths is something we should seek to do everything we can to prevent more people tragically joining that.
But you do know that 1,600 people on average die every single day in this country, and the vast majority of them don't die of coronavirus. What are we doing about those people?
Well, you, like me, probably have seen some of the analysis that people like Carl Hennigan have done on excess death rates compared to 2018, 2019, and the analysis and explainers he and others have done as experts in this field of how to interpret this data. But there are still multiple approaches to interpreting this data at the moment. It's still relatively early. 6 months on, we started off with a disease we didn't know anything about. We didn't understand how it behaved, even its genome sequence. We didn't know how to treat it. We've made a lot of medical progress in the past months, and huge credit to our amazing scientific and medical teams who've worked out how to treat it, how to keep people alive who would otherwise have died. But we do still have a very, very real threat posed to people in this country by what is an horrific disease, which does still kill significant numbers of people, and for which we still don't yet have a vaccine or a proven cure. There are ways we can reduce the death rate, but we don't have a proven cure. I think it is the right thing to do to protect life. Okay. But of course, going to your fundamental point, Do we have to strike a balance in doing that with protecting the economic life of our country and ensuring that that can get up and running again, as we have done? Of course we do. And that's why we seek to strike that balance using local lockdowns rather than national lockdowns, and why we see restrictions flexing to try and keep infection down, but also to allow the vast majority of businesses to try and get going again.
Edward Argar, we'll have to leave it there. Really appreciate you taking the time to talk to us. Health Minister Edward Argar.